Welcome to the lesson 4 of the FN Green Skills for Nurses Planetary Health course. In this lesson, we will focus on empowering healthy lifestyles for planetary health, with the main focus on nutrition and physical activity. This lecture aligns with the core competency tree to empower individuals, families, and groups towards healthy lifestyles and self-care. Health promotion and empowering healthy lifestyles are fundamental aspects of nursing. Often, the choice between being sustainable and investing in health is presented as an either-or decision. However, there are health co-benefits of sustainable lifestyle. Sustainability and planetary health interventions have the ability not only to improve the environment and protect the planet, but also to improve the health of populations and your patients. The EAT Lancet Commission points out the interconnectedness between nutrition and production of food. Human food consumption and the production of this food have impacts on both human health and environment. Environmental changes from unsustainable food production in turn will impact human health again. In simple terms, what your patients eat will impact their own health and the health of the environment they live in. To start with, we will look at the health consequences of unsustainable food consumption. Food is unequally distributed across the globe, with more than 820 million people undernourished, but at the same time, 2.1 billion adults are overweight or obese. The rising prevalence of overweight and obesity also leads to a rising global prevalence of diabetes, which has almost doubled in the past 30 years and will most likely continue to rise. Unhealthy diets are the largest global burden of disease and pose a greater risk to morbidity and mortality than unsafe sex, alcohol, drugs, and tobacco use combined. Additionally, much of the food that is produced is waste. In the EU, about 20% of the food is waste. There is a trend of increasing consumption of ultra-processed foods, which leads to a global dietary homogenization, the use of cheap materials and chemicals in food, and the high contents of sugar, salt, and fats. On the other hand, there are huge environmental impacts of food production, as agriculture occupies about 40% of the all global land. There is a large-scale conversion of natural ecosystems to crop plants and pastures, and it is the largest factor causing species to be threatened with extinction. Additionally, food production is responsible for up to 30% of global greenhouse gas emissions. You will learn more about emissions and climate change and its health impacts in Lecture 8. In agriculture, nitrogen and phosphorus are overused and misused, which causes eutrophication in zones, in lakes, and in coastal areas. Food security is impacted by unsustainable food production as well. For example, 60% of the world's fish stocks are now fully fished. More than 30% are overfished, and the catch of global marine fisheries has been declining for decades. This means there are lose-lose diets, diets that are both unhealthy for the humans who eat them and unhealthy for the environment in an unsustainable way. Environmental degradation resulting from these lose-lose diets might further exacerbate poor health. Negative effects include premature death caused by poor air quality from biomass burning for agriculture and land clearing, reduced food security resulting from low yields due to changing climate conditions, diminished nutrient content of some crops due to the rising atmospheric carbon dioxide concentrations, and famine exacerbated by extreme weather events such as droughts. This is why it is important to shift to a planetary health diet. The UN estimates there will be 10 billion people by 2050 in the world. And to feed them all in an healthy way, we need to start creating healthier and more sustainable diets. The Planetary Health diet is flexible. It recommends intake level of various food groups that can be adapted to the local geography, culinary tradition, and personal preferences. It recommends consuming a range of food that will promote health and well-being by reducing the risk of overweight, obesity, and non-communicable diseases. This means that in some part of the world, the diet involves increasing access to certain food groups, while in other areas, the diet requires a significant reduction in the overconsumption of unhealthier foods. For example, in the EU, the food groups of added sugar, dairy, and animal sourced protein are consumed at a very high portion, and this consumption needs to be reduced. The Planetary Health diet does not recommend for everyone to become vegan or vegetarian. Shifting from unhealthy diets to the Planetary Health diet can prevent 11 million premature adult deaths per year and drive the transition toward a sustainable global food system by 2050 that ensures healthy food for all within planetary boundaries. For nurses, there are many opportunities to get involved. You can conduct dietary assessments of your patients by assessing their individual diets as a standard clinical evaluation. This will help address specific nutritional needs according to their age, sex, comorbidities, and physical activity levels, and requires added sensitivity towards the needs of vulnerable groups. Monitoring changes in individual diet quality over time continuously and alongside their nutritional requirements can support long-term healthy lifestyle changes. You can also provide professional counsel by giving individuals and vulnerable groups dietary guidance and by encouraging breastfeeding and providing information on nutritional requirements for maternal and child health care. You can promote the planetary health diet while also giving special considerations to vulnerable groups such as expectant mothers, children and adolescents, and individuals suffering from chronic diseases. Furthermore, you can support education and training by actively participating in education campaigns in schools and other public services to promote the planetary health diet. Nurses are trust, and your input can have a tremendous impact. Including nutrition and food systems in the nursing curriculum as main determinants of health is important as well. Lastly, you can help by changing the food procurement practices of your healthcare institution. They should focus on sustainably grown food to provide healthy food and beverage from sustainable food systems to a high standard. By getting involved with the work of your institution's procurers, you can ensure that food procurement and provision activities minimize food waste and food loss in healthcare facilities. And finally, you can advocate to your community, your healthcare institution, your national nurses associations, or to the EU institutions. You will hear more about advocacy in the lesson 9. Next, let's turn to nutrition. Physical activity is a major determinant of health. As a nurse, you can have a big impact by promoting healthy lifestyles. Mobility influences health in many ways. Physical activity has been well documented as having a positive impact, a positive effect on, for example, cardiovascular health, mental health, and obesity. The way we are mobile, the way we travel, also has an impact on health, as motorized travel contributes to sedentary lifestyles of individuals and also leads to the air pollution and noise that harms everyone in the community. Active